this is your favorite segment. Now, every mother should have access to quality healthcare during pregnancy and after birth. Similarly, every child deserves a healthy start in life. Yet, while health experts advocate for this, more often than not, inequity in healthcare curtails the survival chances of these demographic, especially those from underserved areas. On this episode of Health Digest, Gloria Milimu looks at how simple yet crucial interventions are helping change the health indicators of Nairobi's underserved areas of Makadara and Kamukunji. Take a look.
In the narrow pathways of Nairobi's Kiambu slum, community health promoter Beatrice Isige, who is among the county's 7,820 CHPs, is on a routine household visit and moves from door to door. Today, her focus is on 24-year-old Ruth Witsa and her unborn baby. For Isige, it is imperative that she keeps a keen eye on clients like Witsa, whose pregnancies are high risk.
Tulipatana naye akiwa ana bleed, mimba ikiwa 3 months, na wakati nilipatana naye ana bleed nilifanya referral na kaenda Bahati, ambapo kufikia kwa saa hii naona ako sawa.
While bleeding during pregnancy may pass for a harmless spotting, sometimes it may be an indication of life-threatening complications like ectopic pregnancy or miscarriage.
Wakati unakula.
Even so, in most cases, such symptoms are often overlooked, especially in such setups.
Kila wakati nikikaa damu inatoka. Sasa ndo nikakutana na CHB wangu Days, akaniambia takurifaa uende OC uangalie shida nini. Kwenda kuangalia akapata mimba ilikuwa inatoka.
However, Isige and her fellow CHPs are seeking to change that narrative, one family at a time, saving the life of mothers and their bundles of joy through such visits.
Mimi nilipata na changamoto upande wa unaona mama ako mjamzito na amefura miguu, wewe unaona ni kawaida, amenona ni vile ako mimba, kumbe tu kujuanga ni danger sign.
The challenges facing maternal and child health in underserved urban areas of Nairobi have been catalyzed by the ever-growing population due to an influx of migrants from rural and other urban areas to the capital city, who settle in already crowded neighborhoods where healthcare services are stretched thin. This migration and congestion, according to experts, has an impact on the maternal and child health outcomes. And sub-counties like Makadara and Kamukunji have experienced it firsthand.
We face a myriad of challenges within Kamukunji sub-county. We know that it hosts a majority of the refugees and the migrants within this, are hosted within this sub-county. So one becomes challenge of access to the health facility. Most of them are not documented.
The challenge that we are having is the workload and also congestion in our health facilities. You go to Mama Lucy, you find that the wards are full to capacity and you cannot turn away a child who is unwell. So you find that they are sharing beds because we have a big population and our facilities are few.
For instance, Kamukunji sub-county only has 5 public health facilities, and of these, only 2 offer maternity services. And for the longest time, limited infrastructure and gaps in specialized skills among healthcare workers made it difficult to cater for the needs of this diverse population, leaving mothers and children vulnerable at the most critical moments. But now, the transformation is evident. Targeted training programs equipping healthcare workers with life-saving skills is managing obstetric emergencies and therefore turning the tide and significantly reducing maternal mortalities in the sub-county.
We know the top killers the causes of maternal death are postpartum hemorrhage. We have preeclampsia, where the patient has high blood pressure, tears, common causes of maternal deaths. So we've been able to empower them with skills to be able to manage them.
The other issue that we also noticed was now the shortage of essential commodities to offer MSCH services like oxytocin, heat stable carbetocin, and these are now drugs that manage PPH.
In the neighboring Makadara sub-county, obstetric emergencies were also an eyesore. At least 10 to 20 women would die due to excess. Development Goal 3 that seeks to reduce the global mortality ratio to less than 70 per 100,000 live births.
We have established 2 kangaroo mother care, one at Makarara Health Center and one at Bahati Health Center. Basically, we were practicing kangaroo mother care, but we did not have the spaces to practice. So what we were doing initially was, we are giving the mother the baby and she will do a skin to skin at the bedside.
For us to be able to reduce the maternal mortality to the less than 70 that we are projecting in 2030, every year we need to reduce like 57 mortalities per 100,000 live births, and for the neonatal deaths to achieve the less than 12 per 1,000 live births, we need to be able to be reducing this each year by around 1.8.
These efforts have translated into tangible gains. More expectant mothers are completing the recommended antenatal care visits. There is a reduction in maternal and neonatal mortalities and an improvement in child health. However, despite this encouraging progress, experts caution the gains may be fragile, and in order to sustain and accelerate these improvements, they emphasize the urgent need for increased funding towards maternal and child health in the county and bridging the human resource gap in the health workforce in order to sustain the gains made and better the county's maternal health outcomes. Gloria Milimu, KTN.